This is Dr. Deuk Majin, Dr. Ara Deuk Majin, the CEO and founder of Deuk Spine Institute. And it is January 9th, 2020, folks. And we are ringing in the new year at Deuk Spine Institute with some pretty amazing spine surgery. Fixing people's lives, getting rid of their back pain, getting rid of their neck pain, getting rid of their leg pain, sciatica, neurogenic claudication, stenosis, herniated discs. Yep, we're doing some good. So today we've already done one surgery which took most of the day, and that was a open L45, L5S1 decompression, reconstruction, and stabilization with screws, rods, cages, inner body and posterior fusion, osteotomies, and realignment of the spine. That's a mouthful. This next case, by contrast, is going to be done with our Deuk laser disc repair surgery. The only place in the world you can get this surgery done is at Deuk Spine Institute. And it's special because you just saw what the last patient went through. And it was a big, open, ugly incision. I'm going to get started. Ma'am, it's Dr. Deuk Majin. And you know what time it is. It's time to fix that back of yours. All right, sweetheart. I want you to help me out. I need you to lay still. And I'm going to get started, okay? You're going to feel a little stick while I put some numbing medicine, and then we're going to give you enough medicine to numb you up, okay? So she'll be awake until I tell you to put her to sleep. You can give her a little fentanyl if you want to ease some of the pain. All right, we're going to get started. Remember, if you have any pain, you just say ouch, and I'll give you some more numbing medicine. So let's go through this again. The plan is a right-sided L2-3, that's this side, left 3-4-4-5. Yeah, and I'm just pushing with my hand. I'm feeling for her iliac crest to get an idea of where I need to be for L4-5. Okay, a little bit of numbing medicine, little stick and burn. That's normal, okay? Don't freak out. You're okay. Everything's all right. So we're on the left side. Everyone's in agreement?
Agree.
And this side we're doing a left 3-4 and a left 4-5, correct?
Correct.
Everyone's in agreement?
Agree, sir.
Perfect. May need some more numbing medicine for the other side.
Worst part with the numbing
Yeah, that's the worst part. Lay still. You're going to do just fine. Let me get the other side too while we can. So our patients are always awake for the very beginning of surgery. Yeah, we need to get it down to 110 or less than 110. Yeah. So it's real simple. If you can't get it down below 110, we're aborting. So if you're at risk for not getting it down, just tell me right now and I'll stop.
Well, I gave my Grelazine, which takes about 15 minutes to take effect. I did earlier, so that's about 10 minutes in.
Okay. Well, then we'll keep proceeding. And if you're unable to get her under control, we're going to stop this surgery and we're going to reschedule it. Lateral. I'm not going to put her at unnecessary risk to do an elective spine surgery.
Yeah, please.
Okay, it's real simple. I've had to abort before because of blood pressure, and if we have to do it again, we do it again. Yep. It's nice to try to get under control pre-op, but if you're not able to, just let me know. Okay, so wow. What a degenerated spine, right? Let's drop the table a smidgen, about an inch. Do you need some help over there? Mike, you want to? Take your time. Take your time, whatever you need. We'll help you out. Did you drop the table? All right, go ahead and take a shot. So, now what can we do to improve this picture? Can you drop the fluoro or not? All right, I need the table up a half an inch. Yep, shot. That's good. All right. So, boy, that's tough to see, huh? 3, 4, and 4, 5. Why don't we start? Why don't we start with 4, 5? Go ahead, and I need you to get 4, 5 looking better. So, I mean, it's not horrible. You're not far off, but let's see if we can get the end plate, superior end plate of 4 lined up, the pedicles of 4 lined up, and then the inferior of end plate should be lined up as well. So, we're going to keep going, and if we need to stop, you just tell me and we'll stop.
I'm working at a pressure, so I'll keep it going.
The most important thing is that we get it under 110. Without that, we can't proceed. So I'm heading for 4, 5 right now. There's some arthritic facet joint. I need to get around it. Shot. The trajectory looks good. Shot. Let's keep the distractions to a minimum for me. Ooh, I feel that pressure cuff going up on the legs. Beautiful, beautiful, beautiful. Yeah, what is that? Shot. Definitely feeling something bony there. Let's go AP. I'm either hitting the end plate, the back of the vertebral body, or something else. So let's see. So that's the best picture you can give me, right? Have you brought your plates in? Have you brought your collimator in? Oh, I'm actually doing pretty good there. All right, go back to a lateral. So for those of you looking at the x-ray, look, this is one of the worst spines I've seen, right? There's scoliosis, there's kyphosis, there's subsidence, there's even some listhesis. I mean, it's bad. It's twisted, but it's not kyphotic. So she's got that going for her. All right. Now, what are we up against? I need to see that better. I need you to zoom in and give me a better picture at 045. I can see the sacrum. I can see L5. I can see the L5S1 disc. I can see the 045. That's better. Now, what else can we do to improve this picture? I must be a little bit too medial. Is that possible? Yeah, suppose it's possible. Doesn't entirely make sense, but it could be. Shot? Yeah, could be a little bit too medial, so I need to be a little bit lateral. Could back it up and try to get a little bit more lateral. Shot? Uh-huh. Where do you feel that, sweetheart? Huh? You feel it where? Shot. So I need you to help me understand what she says. In her back. Is it in her back? Shot. It's in the back, right? It's not down her leg.
It's not down the leg. No.
Boy, that is. I am definitely encountering some bony resistance. Shot. All right. Let's see what we can do here. Let's give me another AP. So I'm trying to get through the foramen down to the disc, and I'm encountering some bony resistance at the outside of the foramen. And I want to make sure my anatomy is right with the fluoro, and it's easy to get it wrong. It looks beautiful there. Let's go back to a lateral view, please. See, what I'm hitting is that facet joint. Look how big it is. It's really arthritic. I've got a few tricks yet. I'm not ready to quit. Don't you worry, we're going to get this done. But I got to redirect. Just lay still. Shot. Hoo-wee. Shot. I can feel all those bone spurs. My gosh. Yep. Very big. Very big. Shot. We just need a little lucky break. If we can get it. Definitely a lot of arthritis. Are you okay? Uh-huh. Hmm. So close, yet so far away. Let's bring the table up a quarter inch. Yep. One more shot. All right, let me have control of the wag. I have a feeling we're off. Shot. Nope. Shot. Mm. Mm. Shot. What do you think about that, Luis? You think we're off more? It's almost like we're looking down the L3-4 disc, right? To me, it looks like that's better. One more right there, shot. I think that looks pretty good. What do you think? You think we're off or you were good? I know we gotta stop, lock it there. What we need to do is, we need to do this, or this. No, 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 do not do, what did you just do? I don't want you to move north. Alright, that's fine, move north. Let's see where we are, shot. Alright, so what do you think about that pedicle? There's just a lot of scoliosis. She's doing fine. You're not doing anything wrong. I just need to try a little harder. I think we need to do that. Let's do that a little more and see if it makes it better or worse. Shot. I can't really tell. I can't really tell. Let's go the other way. And shot. What do you think? I'm open to suggestions. It looks like we should go back, right? Go up. Bring your side up. And shot. I mean, you got her flat on the bed, right? Let's go again, a little more. Let me see something. Looks like the facet's there. Shot. I think that's better, right? Do you agree? Yeah, it looks like we're hitting the facet. That's the problem. You see it? Thank you. Good. Don't move anything. You were fine right where you are. I mean, I'm hitting the facet. That's the problem. So I need to slip around it. I need to slip around it. Shot. Probably won't see anything. Shot. Shot. All right. Where's L45? I'm having a hard time seeing it. There it is. All right. So we're kind of heading towards it. Are you comfortable? Shot. I'm back where I started, but a little bit more lateral. Shot. I just get the feeling our pedicles are not lining up. We need to go, I mean, at L4 we're okay, but look at L5, we're so off. We need to do something. No, bring this down some more. Let's see what happens. It may be that we have to go up on my side. And shot. That's actually better. Wow. Where'd the needle go, right? That goes to show you how important getting the right fluoro shot is. Shot? Come on now. Shot? You'll be a little bit higher. Where do you feel that, sweetheart? Shot? Where? Alright. There it is. Shot? You're doing great, by the way. I know this isn't easy. Shot? Alright, so I'm a little bit too low. Shot? You're not making this easy for me, shot. But don't worry, I'm not upset about it. I'm just joking with you. I'm trying to... Are you feeling any discomfort, shot? So that's got to be the facet. Just hitting bone, shot. Question is, look how close we are, right? So we're right there. Let's get a AP. We're right, very close where we need to be at this level. Let me see her MRI. Oh yeah, I see. She's got horrible stenosis there. Yep. Horrible. That lateral view I think is not too bad. Let's go ahead and get the AP. Yeah, we're good. Go back to a lateral. We're right there. You can see it. Right where the disc is. We're right in the foramen. You can see the facet joint, how arthritic it is right above. Yep. If we can just get this to go, we'll be fine. I may actually be banging against a bone spur. Nope. I actually think we're hitting a bone spur. I don't think this is the facet. There she blows. It was a bone spur. AP, let's just make sure it's not deflected. So, folks, this is a tough one. And I'll be honest with you, the beginning of the surgery is always the hardest. Yep. Once you get everything where it needs to be, it gets easier. But this beginning part is the most important part. Are you comfortable? All right, just relax. I'm going to give you another little injection on the other side. Try not to move so much. You're fine. Everything's okay. That's normal for what we're trying to do here, okay? Yeah. You're doing great. It's not your fault. I mean, I'm putting a needle and injecting medicine, so it's understandable that you're going to be uncomfortable. But unfortunately, there's no other way to do it. Skin knife. So we're doing left 3, 4, 4, 5. We've got 4, 5 accessed. We need to get 3, 4. You're doing a great job, by the way. It's me that needs to do a good job here, and so far everything's okay. We're not having any problems. It's just you're not making it easy. I didn't expect you to. Huh? I know. You're fine. Listen, you're fine. Don't worry about it. Don't be upset. Listen, I've had patients much more challenging than you, so you're doing real good. Isn't it amazing to be awake for this part of the surgery? Shot? I mean, not like, I don't mean it's a pleasurable, but it's kind of interesting, isn't it, to be awake for part of the surgery? Shot? You'd rather be knocked out. I'd rather you be knocked out too, trust me, but I need your help. If we want to do this safely, which we do, safety is the number one, number two, number three concern, I need you awake to talk to me and tell me if there's a problem. And then once I get everything where it needs to be, I can put you to sleep, okay? But right now, I need your help. I can't do this without you. If I do, it's only going to put you at much greater risk. And I don't want you to have any kind of complication. I don't think you're going to, but I'm not going to let it, but that's part of being awake, you know? Helping me. So just bear with me for a few more minutes. All right, so now I'm dealing with the deflection issue from my previously placed needle shot. But our trajectory looks decent. Shot. And we're trying to get to that 3-4 disc. Shot. I got to sneak up on it. You feel anything? Huh? AP? I can't hear her. In your back or down your leg? So what I care right now about is her leg. Okay, fair enough. Did you save that lateral? All right. So we're pretty lateral. Let's see what we got. Let's go back to a lateral shot. I could be a little bit more medial. I may have to redirect more medial. Lateral. Shot. Yeah. Shot. 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 Yeah. Shot. Shot. Folks, this is really the hardest part of the whole surgery, to be quite honest with you, is getting these things into position. Shot. Once I have them into correct position, then the rest of the surgery is pretty darn easy. Shot. No secrets, no magic, just I could feel all the soft tissues. You know, there's so much thickened ligaments and herniation right here. It's incredible. I should be hitting the back of the vertebral body. I am. So I want to try to change this trajectory just a little bit. Shot. I want to sneak in a little bit higher. Shot. Just under the end plate of L3. Are you okay? Yeah. And this is, like I said, the hardest part of the whole dang surgery. Shot. And literally millimeters. Millimeters. Shot. So okay, so it's the trajectory. Let me see, let me think for a moment. I'm getting pushed down and deflected. Give me an AP, please. I can make this work. I can make this work. I could feel the herniation. You could see the patient has what's called a listhesis with the top bone slipping backward. Yeah. Yeah, there it is. I think we're good. I think we're good there. I'm not in the disc, but I'm close enough that I can put a guide wire and get in. All right, we're going to leave that. And let me think for a moment. We need to go to the other side. So why are we draped here? Shot. Shot. Uh, shot. Lateral. That's better. Lateral. So this surgery I'm doing is really technically more challenging than open surgery with what I'm doing right now. The access is more difficult. Shot. However, once we get this part done, let's do the rotational thing again because it looks like the facets are off again. Try a little higher and then stop and shot. That's worse, I think. Let's try the other way just to see. Again, do some more. I may be going the wrong way, but let's see. Shot. What do you think, Louise? I think we're going. It's really hard to tell with her spine. Let's try some more. Same direction. I gotta convince myself. And shot. Shoot. I'm not doing a good job of convincing myself. Let's go back the other way. Go, go. Or more. Shot. More. Shot. I think I'm going the right way now. Keep going. So it's due to the scoliosis that we're having to do a lot of this movement. One more. Huh. Let's leave it there. I may need more later, but let's leave it there for now. Shot. Is that uncomfortable?
Is that down your leg at all?
No, it's. I don't think it's gonna be down her leg.
Her neck is sore.
Her neck is a bit sore. Shot. Is she? What can we do to make her neck more comfortable? Shot.
Slowly tight fitting, some tension.
Anything about positioning though we can do? Shot. I want to see if we can improve her positioning to make her neck more comfortable. Shot. Shot. She's moving too much. What? What about getting her neck more shot, more in alignment, more in line?
Is it okay to move her pillow?
Yeah, of course. Her neck is not a problem. It's just her
I just want to
back.
make sure she doesn't move
Shot.
while you're doing that.
Well, you can move her. I'm stabilizing my hand, so we're gonna be okay. Shot. Shot.
Better? Better?
Shot. That's looking better. Again, same problem. It's the arthritis she has. That's keeping me shut. We're almost there. We have none of them?
Yes.
Uh-huh.
Local?
Yep. Yeah, sorry, I'm just giving you some more numbing medicine.
Numbing medicine, okay?
Uh-huh. That should ease some of the discomfort that you're having. Shot? 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 That's a better trajectory. Shot? Hitting again the facet. Need to get around it. Shot? So that's looking good as far as a trajectory, but again, it's the arthritis in the facet joint that is blocking us from getting to where we need to go. Shot? What's going on?
I just asked him to go check on that, our previous patient.
Shot? How's she doing?
Doing good. Doing good.
Is there pain? Did she take the dilaudid? Shot?
Yeah, took some PO dilaudid, pain's down about 4 now.
Good.
Took
That's
2 days
great.
to wake her up because she had so much propofol on board.
Yeah. Shot? So close. Shot? Just about there. Where do you feel that? AP? Where do you feel that, sweetheart?
Down your back, down your leg at all, where do you feel it?
In your back? Yeah. Well, we're right near that bad disc. That's pretty good. That's good. Back to a lateral. We're almost done with this one, and then we have one more to place, and we'll be able to put you to sleep. And get on with the show, as they say. Get the show on the road. There we go. Are you comfortable? Is that a yes or a no? You're laughing at me. As comfortable as you can be, right? Given the circumstance of what I'm doing. I've already done it.
No, do you want to try the technique?
I already did it.
How about the 4 card on this one?
When I put this in, I went like this.
Oh, you did it.
Of course. I'm one step ahead of you.
Good.
See? All right, let's go back to an AP. All right, folks, for those of you joining us late, you're watching a Deuk laser disc repair. And our patient, we need to be further north, is having horrible back pain and both side leg symptoms. They have spinal stenosis, degenerated disc, scoliosis, listhesis, instability. They got a lot going on. Arthritis, osteoporosis. And, you know, all that stuff's going on, but go to a lateral. But really what she wants to get rid of is her back pain and get as much relief in her legs from pinched nerves as she can. So her options are an open back surgery, just like the one we did before her, which would take about 3.5 hours. And she would be at high risk for breaking or loosening of the screws, failure of the hardware. I need a better picture at 2-3. And it's a right 2-3, correct? So I need the table down. You may not need that much rotation on your fluoro. Why are you doing that? Okay, we go to a new level, you start over. You understand? Scoliosis is segmental. So just we were down at 4-5 where we had bad scoliosis. Now we're up at 2-3. So I need 2-3 maybe horizontal. Come on, flatten your fluoro out. It's basically every segment is another start over on the fluoro. Okay? So, wow, that other needle looks really weird, huh? Alright, are we too high? I think we may be too high for 2-3. I need to lower it. Maybe I should come in right where the other one is. May actually work there. Might as well try. Knife. So I need you to get 2-3 lined up, my friend. It's not very far off, but it's not exactly where I need it to be either. And maybe we can do all this with 2 incisions. That'd be nice for the patient. So what determines my starting point? What determines my starting point, folks, is the orientation of the disc and the level that we're treating. Can you see 2-3? Yep. All right. So we need to get those cables out of the way. Okay, right there. Shot. Yeah, I really think I should start lower. All right, let's see what we got. Shot. Oh yeah, much better. Shot. Uh-huh. My gosh. It's amazing. You're laughing at me. I like it. It's good to laugh, especially when you're having surgery. I laugh when I'm giving surgery. You're laughing when you're taking surgery. I don't have many patients who laugh while they're taking surgery. Shot. But you can hear me talking. And I love to talk. You know, my mother said I had diarrhea of the mouth. That's what she said. You've never heard that before, have you? Shot. I don't think she meant it in a really bad way, but shot. Trying to get it right there. 1 millimeter perfection. Shot. That looks pretty darn good. So I want to go with an AP view, and let's see where we are. So when you're doing this type of surgery, you need biplanar fluoro. Biplanar fluoro means 2 planes, at least 2 planes. Really what you need is multiplanar fluoro, which means multiple planes. So the most common are lateral and AP. But you want to be able, that's beautiful, you want to be able to do obliques. So we're right at the lateral border. Could be a little bit more medial. Let's see where we are again on the lateral view. All right, so I have a little bit more to go. Are you comfortable? Where do you feel that? I need to know where?
In your back or leg?
In your back or in your leg? Leg. Okay. Thank you. Sorry about that. Yeah. We're going to get there. We're almost there. Shot. That's why you're awake, by the way, for that exact moment that you just shared with me. Shot. Because without you being awake, I wouldn't know, even though it did feel not perfectly right. Huh? You're laughing at me again? Where is that?
Right above the knee.
Did it shoot down your leg? It did. It did shoot down. All right, let me have a skin knife. So we may be able to do this with the same incision, but I certainly need to go more medial. Because I'm ending up too far lateral. I'm ending up I'm ending up just too far lateral in the foramen itself. So I need to get a more medial start, especially at 2-3. I know this sounds like not really understandable to most people, but it's really, those comments aren't meant for the general public. You're allowed to hear them, but they're meant for a surgeon who's going to try to follow in my footsteps so that he or she could understand what's going on. Okay, let's see what we can do better at the top of that vertebral body. I'm just not happy with it. I feel like we're not right. So let me wag it. Give me control. Shot. Shot. I want to say that's better. What would you say? Shot. I think that may be worse. Shot. I think that's probably as good as we're going to get it right there. Lock it. So it's really important that you optimize your fluoro. Shot. We're on the last one, by the way, ma'am, so we're almost done with our part that we need you awake for. Shot. Yep. That's what I need to see. There's the facet right there. I can feel it. Shot. Yep. So I need to be slightly higher, slightly more lateral. Shot. Slightly higher, slightly more lateral. Shot. Where do you feel it? Where?
Top of the hip.
Top of the hip. That's facet pain. Shot. That's more like it. Nothing down your leg, right? Shot. Oh, it's beautiful. Come on now. Oh, yeah. I know you want to go. I know you want to go. Shot. Yeah. You certainly are being difficult. Not talking to you. You're doing great. I'm talking to your spine. It's giving me a fit. But it's okay. We've already got a beat. It just doesn't know it. Shot. Okay. AP. Want to aim it down. Let's see where we are. I know we're in the disc. We've wiggled in. It's not pretty, but it is where we need to be. Yep, that's what I thought. Yep. There we go. Are you tensing up? A little bit? We're good. That's a collapsed disc space, if there ever was one. Shot? Yep. Alrighty then. Now let's just verify we're in the right location with all of our positioners. And then we're gonna be able to put you to sleep soon. Shot. Let's go lateral. So we should be bilateral 4-5. Left 3-4, which this is the left side, and we're 3-4, and right 2-3, which we just did. Have you ever watched one of these surgeries done online? Have you ever watched one of my surgeries? She never has? Oh. How'd you find out about me? Read about me. Very good. Okay. All right. How much of your pain is normally in your back? About how much of your pain is your back versus your legs? 50-50? I need to see the sacrum.
Back versus legs.
More the back. What percentage is back pain?
What percentage is back pain?
No, 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 in general.
In general,
Your typical back pain.
9.
Is that it? How bad does that get on a scale of 1 to 10? 10 being the worst pain of your life. How bad did that get? I can't hear her. 5? Okay. Is that where you typically have your pain? Okay, here you go. All right. So that was 4, 5. Shot? You're feeling the pain? How bad did that go on a scale of 1 to 10? What'd she say? Okay. All right, we're going to put you to sleep. Is your neck comfortable? This last, well, damn it. Let me have the pipe cleaner. I just unscrewed it at the same time I pressurized it, so it's my own fault, but I'm just trying to. We can put her to sleep.
We can?
Yeah. I want you to count out loud for me from 1 to 100. Can you do that? And when you're all done counting, you'll be asleep. I mean, your surgery will be over when you wake up. All right, so. No, you can count.
Oh, go ahead.
Yeah, you can count. Shot. There we go.
Yeah, you can start.
Yeah, keep counting. You're doing great. We're going to put you to sleep while you're counting, okay? I just feel like we got the tip up against the end plate, and that disc is so collapsed. So let's see if we can get anything in there. I don't think we're going to get anything in there. All right, let's start it this side. I need the guy where? Count out loud. All right, doctor, if you can just keep her comfortable. You know, she's not responding so much. That's good. That means she doesn't need to be that deep. You know what I mean? All right, I got like a light right in my eyes. We need to pull this away from my eye. And I need to see a better picture of that. So maybe have the table come up a smidgen. Let's say 1/4 inch on the table. Good. Okay, shot. That's the best we got, right? Are you pulsing? Why would you pulse on a patient that has more body habitus? That makes no sense. Do you understand the purpose of pulsing? Shot. What? What's the purpose of pulsing? It's to decrease the radiation but not go below a therapeutic or a diagnostic dose. Right now you're below a diagnostic dose because you can't see the anatomy. No, I don't want that light. It's bothering my eyes. Turn it away a little bit or something. Turn it over here. That's good. I can see slightly more. I can see enough. I don't. It's reflecting off the drapes into my eyes. That's the problem. So, there we go. Better. Do you understand, Jordan? The goal is not to give a lower dose of radiation. The goal is to give a lower dose of radiation and still have diagnostic imaging. Okay? Shot. So you need to be able to give a dose of radiation that lets me see what I'm doing without without compromising the quality of what I can do. You've learned from Dr. Patel, have you? You see? Okay, folks, the dilator is now at the back of the disc. Part of the reason is my glasses. All right, shot. I can't see that well. That's better. All right. Let's see. Okay, so we're at L45. We're coming down the guide wire. And I want to really seat this nicely. Let me see. Shot. That's probably as good as we're going to get it. Take this guide wire out. Is she relaxed? Shot. She's sleepy? She's okay? Yeah. She's not responding, so you can lighten her up a little bit. I don't want you having her any deeper than you need her just to keep her comfortable. But right now she's like not even responding at all, so that's good. Like not so much, no pain, no movement. So I don't mind if you want to lighten her up for her airway. So one of our spine surgery support group members asked a question. Has anyone had surgery on their pars to repair the pars? And I want to answer that. So what he's talking about, folks, is there are people that have a fracture through a part of the bone in the back of the spine called the pars. And what it does is it lets the facet become free-floating, and it does nothing to hold the spine together. So there's this belief that you can go in and repair the pars. And I can tell you right now that the surgeries don't work consistently. They don't work. So I would be very surprised if the pars repair fixes this patient's problem. And that's to answer their question directly. The reason they don't work is there's so much force on the pars, and the pars is so small that there's no man-made construct that can actually go in there and repair it with the amount of strength that it needs to resist normal physiological loads in the lower back. That's the reason. So all the people that have developed pars repair devices, they all fail. They don't work. Unfortunately, the companies that spend millions of dollars developing the technology, when they fail, they don't say, oh shoot, we failed. What they say is, oh shoot, we owe that venture capital company $18 million. We better sell some of these things, even though they don't really work, to the surgeons and the hospitals so we can get our money back. That's what happens when you start having companies and people investing large sums of money in the medical device technology, is that the company then is more worried about their profitability rather than the patients. And that's exactly what's happening. So whoever's having the pars repair, good luck. I would never recommend it for one of my patients because they don't work. Now, if it works, great. I doubt it will, but if it works, great. But I think it's because they've done something else to you besides repair your pars. There's a lot of sneakiness going on in the world these days. They may do something else to try to fix your pain while they're in there and then give credit to the pars repair device. But honestly, the people that have tried going with the pars repair devices, they've been doing this for about 30 years. They just don't work. I'm surprised there are still surgeons doing the procedure. Maybe you're going to Germany to get it done. I don't know. But in the United States, I don't know anyone doing it because it doesn't work. Now, I could fix your back and get rid of your back pain, no problem, easily, with surgery. But I wouldn't be trying to repair your pars. I don't think it's necessary. I figured I'd answer that question while I had the opportunity, since nobody else is asking questions. Are they, Sean? Are they, Sean?
Say again?
Take your beats off. Are there any other questions, Sean?
Oh, yes, we do have one.
Oh, we do.
Let's-
A brave soul. Go ahead.
A viewer from our prior broadcast actually asked this question.
Okay.
She says that DLDR is moving spine surgery into the future. What do you think is the next big advancement that you hope to see within the upcoming 20 years that will further revolutionize back surgery?
Well, let me repeat the question to make sure I got it. Deuk laser disc repair is revolutionizing spine surgery. That indeed it is. What is the next advancement in the next 20 years that could revolutionize spine surgery even more? Okay, she's moving a bit. This actually is the more painful part of the surgery. She's starting to wiggle around a little bit. And this is her painful disc, one of them. So, what's the next advancement? The most important revolutionary thing that can happen, folks, literally, and I say this without grimacing, without blushing, without anything, without the polygraph blipping, is we need insurance reform. That is the next big thing to happen. Insurance reform. And that won't help not just spine surgery and people suffering with back and neck pain. That'll help everyone in the whole world. Because believe it or not, the insurance companies that rape, pillage, and plunder America are the same ones doing it in other countries. Okay? It's the same banks, the same insurance companies. And we need to put them in their place. Insurance companies have one purpose. Do you know what that purpose is? That is the purpose of sharing. No, their purpose, the reason they were created was to share risk. Share risk. What does that mean? Let's say you got to drive home in a car, an Uber, right? And it's going to cost you $40. Well, if you get 2 more people, then it doesn't cost you $40. If you get 3 more people, it costs everybody $10. So that's sharing risk, okay? That's sharing cost. Because you all benefit and you all pay less. You have what you need and you pay less for it, okay? That's what insurance is supposed to do. There's supposed to be a small profit, a modest profit if they run the program well, but they're not supposed to be gouging people. They're not supposed to be denying treatment that doctors recommend to make more profit. That wasn't part of the original blueprint, and it's still not part of it. The only reason they're getting away with it is because they're lying to the public, and they're telling the public that the reason the cost of healthcare is so high is because of doctors doing unnecessary surgeries, or hospitals overcharging, or emergency rooms treating patients without emergencies. That's all nonsense. It's hogwash. It's 1,000% hogwash. The reason why healthcare is so expensive is because of insurance premiums and denials to pay bills properly. So, as long as the insurance companies can be the pirates of the 7 seas and do whatever they want, whenever they want, however they want, then we are going to see medicine fall on its face yet again, and worse in many different fields besides spine. So, the most important advancement for the next 20 years is insurance reform. And it's so simple. I'm not even asking you to elect me president. I'm just telling you what you need to do. You need to get the laws written so the insurance company cannot deny a doctor-ordered treatment or test. Period. Period. If you do that, it will fix everything. Sure, there are shitty doctors out there, and sometimes you shouldn't listen to them, but that's the patient's choice. Patients should be empowered to do what they believe is best for themselves with a doctor's recommendation, whether they want to follow it or not. It shouldn't be the insurance company saying no. So that's the biggest advancement we need in healthcare. The other advancement we need, which is almost as important, is I really feel like Papa John's pizza has a lot less cheese on the top, and I think they need to increase the amount of cheese they put on their pizza by at least 40%. back to where they used to be a few years ago. I'm glad. Me too. Where are you from originally? That's what I thought. You're Puerto Rican. Well, it's funny you say that because we don't hire Puerto Ricans to work here. So how did you get in here? Huh? Luis, how did you let this guy in? Luis, I don't know. He's my cousin. All right. Anyway, all jokes aside, this herniation is getting it bad from the laser. You can see the laser is zapping away the herniation little bit at a time, and you're seeing the herniation at the, oops, she's moving a little bit at the bottom of the tube. You can give her a little fentanyl if you want. I mean, maybe it's just the pain that's bothering her rather than sedating her. I'll leave it up to you. It doesn't matter to me, but she's not moving that much. So if she's stable cardiovascular-wise and you don't want to give her anymore, that's fine with me. This kind of movement's not going to affect the surgery from my standpoint. I just don't want to stress her heart. Good. So whatever you feel is necessary, doctor. My Puerto Rican doctor friend. Man, Puerto Rico has just gotten it so bad lately, huh? I mean, a freaking hurricane that destroys the island and then an earthquake. Fuck, unbelievable. I said to my wife, these poor people are suffering so badly. I mean, it looks like there's nobody even there. I mean, I think the hurricane got rid of a lot of people, right? And then Medicare cut its support to Puerto Rico, so Puerto Ricans can't get Medicare anymore, right? Didn't that happen?
I don't think it's as far as Medicare, but I know that reimbursements is way cut way down.
No, I think Medicare ended in Puerto Rico unless they pass some legislation. That's what I heard a few years ago was ending. I mean, we get a lot of Puerto Ricans that come and they're like, we need help because they can't get any care. Yeah, I believe it. So why is the view not so good right now? Because we have some bleeding. This is a very minute amount of bleeding. If you were to poke your finger to do a finger stick for your diabetes, it would be the same amount of bleeding. It's tiny. It just looks like a lot because it's magnified with technology. We are using magnifying and illuminating technology.
We have another question.
We have a question. Yes.
One of our viewers says, I had a lumbar decompression done in 2018. My groin ligament got torn during the surgery and never fully healed. I had a pain stimulator put in 8 weeks ago, and when I tried walking today, my ligament is still very painful and my knees are cramping and spasming. I've been waiting so long to get better. What should I do now?
Come see me. So one of our viewers says, I've got a pulled ligament in my groin after back surgery, and it's hurting. Come see me. Let's figure out what's going on. Is it a ligament? I mean, you're sure it's not a hernia. A lot of people have hernias, and a hernia feels like a pulled ligament in their groin. You got to make sure it's not a hernia. If it's a hernia, you need to get it taken care of. So the only way to know is to go see your primary care doctor and have them check it out, or a surgeon. Not a spine surgeon, because I can't tell you. I don't know how to tell that. But I would send you to a surgeon to have it checked out. But if it really is your hip, then I would strongly recommend some physiotherapy and probably an MRI to make the diagnosis. But seriously, come see me and let me make the diagnosis. It may not be a groin ligament. It may be something else, like a nerve in your groin or something else. I just don't know until I can examine you. But I've seen a lot of misdiagnoses over the years. I'm sorry I don't have a better answer for you. But the truth is that I've never heard of a groin ligament being pulled from spine surgery, so I got to first verify that that is the case. It could be a capsulitis. It could be a trochanteric bursitis. It could be a hernia. It could be neuralgia paresthetica. There's like a bunch of things it could be, And depending on what it is, you need different treatment. Like if it's trochanteric bursitis, you need a shot in your trochanteric bursa. If it's Meralgia paresthetica, it's a pinch lateral femoral cutaneous nerve. You need a shot into that area where the nerve is to make it feel better. If it's a hernia, you need hernia surgery probably. So depending on the cause, you need different treatment. But I'm not confident of your diagnosis. So I would like to make the diagnosis myself before I give you advice on how to treat it. Okay? Sorry. Okay, folks, so here we are. And the reason why there's blood is that there's a lot of inflammation here. Okay, a lot. Why is there so much inflammation? This patient has bad arthritis. I mean, you can see it on the spine. There's a herniated disc right there, piece. We're zapping it away. Getting rid of it. Yes. Yes, yes, yes. Gone. All right, there's your tear, your annular tear. This is why I couldn't get the needle in. Remember we struggled? Rewind and you'll see. This right here, bone spur. Luis, I'm having a hard time twisting it. Okay, it's better. So if anybody's going to be in the Miami area, come visit me. We'll be racing in Miami this weekend. Deuk Spine Racing and Arias Duke Majin. I'm really hoping that there's some good competition. I know that Ryan Norberg will be there. He's a national champion 4 years in a row in seniors. I'm hoping Lorenzo Travasinuto comes. Matias Morgado, the South American champion, will be there. So it should be some good racing this weekend in Homestead, Miami for go-karts. Some of the best drivers in the world will be there competing. So if you live in Miami or near Miami, come on down.
You should get some dives in while you're down there.
Get some scuba dives in? Well, that's going to be hard for me to do. I am going to be in Homestead, so it's not too far away. Where do you recommend I dive down there?
Well, honestly, I like West Palm probably the best.
West Palm, really?
Yeah, wetter the better is a good boat.
Where do you dive in West Palm? Just off the coast?
Yeah. Well, no, I take a dive boat out, a couple different dive boats.
Uh-huh. How far out do they go?
You can literally see the shore.
So it's close.
Yeah, probably.
So there are reefs out there.
Yeah, 65 feet, 70 feet.
Artificial or what?
No, no reefs.
All right, I'm going to try to take this laser off. I'm going to try to see if I can't get this bleeding to stop for a second while I take a look around. Magic, huh? Look at that. There's the nerve right up there with that scar tissue on it. Right there. I'm going to zap that a little bit. I need to zap some of that. Take that. Do they have that? Just bone spurs. People think the laser can't get rid of bone spurs. It sure can. Easy peasy, Chinesey. Used to be easy peasy Japanesey. Now it's easy peasy Chinesey. Did you know that? What do I think about the airplane that got shot down? I think I think war is bad, period. I think war is bad. I think war is necessary to preserve not freedom, but to keep people from suffering. Basically, good versus evil is what it comes down to. I believe in fighting evil, and evil isn't just people that want to take away your right to wear pumps on Saturday night at a nightclub. Evil is like people that allow others to starve to death, that use chemical weapons on them, that don't allow them to practice religious freedom. So, shooting a plane down is an act of war. Yeah, it's bad. Anytime you shoot a plane down, it's bad. People die, right? Unless it's an unmanned drone. I mean, if it's an unmanned drone, well, I feel bad about the $35 million we spent or whatever it costs to build one of those. But it's not the same as losing people's lives. So, I don't know. My son said to me the other day, Dad, do you think World War III has started? And I thought, World War III started a while ago. I think it was Governor Bush or President Bush that started it. Maybe it was before President Bush. Who knows when it really started, right? I mean, who knows when World War II really started? Do you know? When did World War I start? I mean, the people that live at that time period, they don't know a world war just started. All they see is a skirmish or a battle or a small war. But in reality, that allies get involved, trade interests, money, politics, all that gets involved, right? And then pretty soon you have many countries warring against each other, getting involved. Then it becomes a world war. Has World War III already started? Who knows? History will tell. Am I concerned? Absolutely. Very concerned. But I rest assured knowing that Great Britain is on our side, that we have allies like the Koreans, the South Koreans. Let me qualify that. We've got good allies. I think we have countries that don't want war. They want peace. I mean, gosh, don't we have enough problems in the world without war that we can fix, that we can work on fixing? We do. We do. What do you think about the plane that got shot down?
I think it's sad. 178 people. That's a lot of people. A lot of people on the plane. And I think of a plane free falling on a plane 7,800 feet is terrifying.
Exactly. See? Terror. Terror is bad. So who shot it out? The Iraqis? No, the Iranians?
I heard today it was possibly Russia.
Yeah, Russians. It's damn Russians.
It was on the way to Ukraine.
I'm not surprised. Crimea? There's all this battling going on over territory and... all right, shot? Oh, get in there and get a shot. Yeah, no, it's horrible. Horrible. Life is hard enough without somebody trying to kill you. Oh my gosh, that's such a horrible picture. Can't you do better than that, Jordan? Please tell me you can. I need better picture than that. That's better. A little bit better. All right. It's going to have to do. That's for sure. That's better. Yeah, darken it up. You're cheating, but that's okay. It works. Okay. So I'm going to get this in there and do my best to guide. Shot. Uh-huh. So a lot of the surgery uses guide wires, which are sturdy little metal wires that allow me to bring in more robust, thicker tools to do the surgery. Shot. Okay. So relax for a second. So I'm using this guide wire to navigate down through the muscles to L3-4. Shot. Uh-huh. It's still really hard to see, my friend. She's moving a bit. She's moving a bit too much. Lie still. Everything's okay. Shot. That's better. Just lie still. You're doing great. Don't worry. Everything's okay. She's sleepy? All right, don't move around. Give her some more fentanyl, maybe, if you want, just a little bit to ease the pain, because I'm right where her second bad disc is. Shot? Yeah, right there. All right, she's not moving as much. Pressure, Louise. Not too much, just a little bit. Let me have that. Actually, relax a little bit. You're pushing my tip away. Yeah, if we can get her a little bit deeper, that would be better. Shot? Shot? Uh-huh. What? Yeah, of course. No, I want to see her. I'm going to be done in half an hour. Let her stay. Shot? Yeah, she's wiggling around too much. Yeah, but I don't think that's going to work. Take. I want an AP. What is that voice? Wait, before you take a shot, give me a coker. The Jedi mind trick. Don't move. I don't think that one's gonna work. Should I call it the Puerto Rican mind trick? Shot. Beautiful. That's perfect. Back to a lateral. So we're right where we need to be on the AP and on the lateral. I'm going to have to pop the guide wire out. So, no, not yet. Luis is getting a little excited here. All right, give me another shot. Nope. Overexposed. Nope. Overexposed. Other way. Okay, I need to see that disc space. I really do. Lay still. Everything's okay. Hold her down. Sorry, folks, but it's how surgery really is. Sometimes patients with propofol get light. And shot. I need to know when I can proceed.
Don't move, okay?
Just lay still. You think she's...
She's just on that stage where she's not following commands. But I gave her
Shot.
fentanyl already.
You gave her what? Sufent?
Fentanyl,
Yeah.
just to make sure.
Shot. We're in. We're perfect. That's what I needed right there. Okay. What are you doing?
That's what you said. We're okay.
Louise, you're cracking me up today. Louise is ahead of the game. Yeah, you're not liking that. We need to do something because this is too much wiggling around for me. I believe in being light and all, but shot. Light and all with night and all. Shot. All right. Now I need that thing. Yeah, now I need it. You're doing great, Shot. Everything's okay. We're perfect. Right here, right now. What was that? Incoming? Okay, so are we next? Are we next? Never mind. Any more questions from the audience?
None currently.
Is that a yes or a no?
No.
My God. What's going on there, Sean? Our audiences are getting more and more boring to me. We got to ask some questions, folks. After all, you got the easy job. You got to sit back and watch. All right, so we're in the L3-4 disc, which is the second one that we're fixing on the patient's left side. Look at that fragment of herniation. How did it get in there? Well, how did it get out? That's the real question. The blue stuff is the dye that we use to help me find the herniations. Here, let me show our audience. Let's get a light on so I could show them. Okay? Might as well. Gotta stimulate some discussion somehow. You ready here? I need some light here. Can you see?
We can see.
Well, but you can't see the blue, can you? Yeah, aim it right here. Can you guys see the blue disc?
Yes, we can.
All right, so the blue stain is a dye that I put in. It helps me find the herniations. The blue actually stains what's called degenerated disc. Degenerated disc is the part of the disc that's been ruptured out, and over time it degenerates.
Thank you.
So she's sleeping nicely, it sounds like, right? Snoring blissfully. Huh?
That was me.
Oh, that was you. All right, good. Well, if you can snore like that and still do your job, I'm happy. You got talent. Take. Okay, we're almost done with this disc. Oh, there's the tear. Look at the pink stuff, guys and gals. Can you notice a pink? Like a pinkish color? It's very faint. It's like a pink right up there in that nest. Imagine that that's like a little black widow spider's nest full of pain and suffering. Okay? Are you going to be all right? You can sit down. But you're not getting lightheaded, are you? Oh, okay. I'm sorry, when I said black widow spider and you breathe, I know I don't like him either, but I thought you were going to faint. Okay. So that's what's causing her back pain right there. So we're going to get rid of it. We're going to just vaporize it. Okay. Here. Is this 4th of July? I'm hearing all kinds of fireworks, noises. Yours or hers? We need some music. What is going on in this room? Please. I can hear myself hyperventilating. All right. No, I've never dove for lobsters. I don't want to go to jail. You have to dive in the season. You have to have a license. But no, I mean, I've seen lots of lobsters diving, but we're not allowed to touch them. I've grabbed their antennas once. They just kind of wiggle it around real fast. It feels weird. Oh, I love lobster. Trust me. Yeah. What were you going to say, Mike? I just honestly just don't have a lot of time, to be honest with you. I've kind of preoccupied myself with things that take quite a bit of my time. About 18 hours a day is worth of my time. My kids mostly. Oh, I should say this. Oh, but I'm not allowed to say it. I have 2. I think I'm allowed to say it, but maybe I'm not. I better not say it. Yeah, my kids are at a very high level of sports, and my daughter was just given an award or a privilege, but I don't think I'm allowed to announce it. Oh shoot, I shouldn't have put it on Facebook. Oh, I just realized that. I am in deep caca. Oh my god. Oh my god. Can somebody pull up my son's Facebook account? Alright, we got air bubbles. You switching the irrigation? I better shut up now.
We have a question.
Yes. Thank God we have a question so I can change the subject. Yes.
One of our viewers asks, is the blue dye that we're seeing methylene blue?
Is the blue dye we're seeing methylene blue? The answer is no. Methylene blue does not stain degenerated disc. It's another dye very, very close to methylene blue. But it's called indigo carmine. Indigo carmine. I don't mind sharing that with you. Indigo carmine dye. And the nice thing about indigo carmine is that it stains the nucleus pulposus when it's been herniated and degenerated. So it helps me find the annular tear because the nucleus pulposus is wedged into the annular tear. And it also helps me find degenerated herniated disc. So indigo carmine, it's another type of vital dye, just like methylene blue, but very different. Methylene blue doesn't work for this. Good question. I wonder who asked that. So I might as well say this while I've got all of your attention. Deuk Spine Institute launched its very first app about 3 or 4 months ago. The app is free. You should download it if you're interested in what we do in spine. It has lots and lots of information. It's really fun. And you can take a break off your Facebook page and you can go play with the app a little bit. We don't charge for the app. It's free to download and it gives you access to all kinds of content that's very, very useful. It was developed by Zach and myself and Sonny at Deuk Spine Institute. Boy, this is where all the pain comes from, by the way. This is the herniation in the back, really in the back of the disc. Oh no, I'm going to get in so much trouble. I hope my daughter, I better call my wife. Oh, she's going to kill me. Okie doke. Again, why do we have all this bleeding? We have bleeding, it's not a lot by the way, but we have bleeding because this lady has had chronic inflammation in her facet joints for a long time and many, many years. And all that inflammation needs to have blood flow. Beautiful. That's part of the tear right there. What's bleeding, by the way, are really the arthritis, the bone spurs, the thickened, inflamed capsule of the joint and the outer annulus. Just about done with this disc, and then I'm going to move on to the next one. And the next one will be L45, but from the opposite side. Standby laser. Okay, sorry about the fumarole of blood, but looks like we have a few of our fibers missing, right? Luis, you see them? A few of the fiber optic out. That's the little stars. Scope is off. I'm going to come to your side to do the other two. Great job. So far so good. She's really under good control right now with her pain. She's not responding at all. Luis, pressure. I'm going to switch sides. And our last patient, are they here? Are they at 1 level or 2 level? Oh. It'll be quick.
Levels by level?
No, no, no. Two level. This is 4. So 2 level means 2 needles. It's probably like unilateral 4551 or 3445. Okie dokie. So let's get this done. Take guide wire. Whatever. Oh, we don't have the music we had before. Flo, is that right? Oh, okay. So, but Amy had it before. Is that why? Shot. See if you can clean that up, Jordan. I was talking to Jordan. I asked him to clean up his act. Me? Oh, so just put red hot chili peppers or something. That'll be good. Under the bridge. You're doing great. Just relax. Perfect. Shot. Oh, wow. We're over by the facette. No, we don't want to get Facebook shutting us down again. Shot? Oh, yeah, they shut us down. Yeah, copyright infringement. They think that we're making money selling their songs. It's ridiculous. A little more volume. You can go a little louder. Shot? Shot? I can't see anything, Jordan. It's killing me. Seriously. I need you to try harder. I've seen better pictures than that on this same patient, on this same day. Shot. So find your way. 'Cause she's my companion. Who is he talking about? Anybody know? He's talking about Los Angeles, the city of angels. Los Angeles. Lay still. You're doing good. Let me know when I can proceed. With surgery, because I shall proceed with dancing until then. All right. Are you giving her a little more? Okay, thank you. Okay, here we go. Almost there. Shot. I would say drop the table a smidgen. Or, sorry, raise the table a smidgen. Unless you just opened your collimator. Did you? I think that's close enough. Stay there. Let's get a little bit more. Okay, take it. Boy, she's really airplaned over, huh? She's saying, leave me alone. Look at that body. Come back over here, sweetheart. Good. Luis, keep an eye on her. Is she strapped down, right? Good. I don't want her coming off this table. It's really a miracle that we got into these discs. With how twisted and collapsed her spine is. I feel very lucky that we got in. Shot. Just keep an eye on her thorax. I think we got her leg strapped pretty good, but just keep an eye on her thorax. Shot. That should be good. Are we getting kicked from Facebook? Oh, okay. All right, maybe I should start singing. Okay, we're good. Let's get the flow out. Write my own music. I'm terrible. Musician I am not. God did not grace me with those abilities. How about if I just sing it? Then there won't be a copyright problem. Move. Pull it back, man. More. It's going to interfere with my ability to do the surgery. You need to get it back. That's good. That's right there. That should be good. Now watch it like a hawk, Jordan. Okay, we are in L45, opposite side. The only problem is my hand's going to hit this thing. No. Pull it back towards you. It's more. You can keep it sterile and back. You can't keep it sterile up there. What's wrong?
She's just obstructing.
Don't let her obstruct.
I know.
No, don't. Seriously. It's not worth it. I'd rather have a moving target. Just don't let her come off the bed. I need that laser. I need the pedal if I don't already have it. Come on, guys. Pedal. Pedal to my right foot. All right, that's fine. Right where there. Laser. And you get on that body and you don't let it come off, Luis. Dude, are you kidding me? You should be the laser master. Okay? You understand what I'm saying? You ever watch Indiana Jones? You know how he is with the whip? You need to be like that with the laser fiber. You need to be the Puerto Rican Indiana Jones of the laser fiber.
We have a couple questions.
Oh, questions from the audience, of course. Of course, that's why I'm here. All right, laser off. Let's take the questions.
We have a viewer asking, can you do DLDR from anterior position or only from posterior?
All right, great questions. Can I do the DLDR from anterior, which means through the front of the body, or only to the back? The answer is I can do it through the front in the neck, but I can only do it through the front in the neck. In the back, you have to go through the back. So, yeah, in the lumbar spine, it must be done through the back posteriorly. And in the cervical spine, it must be done through the front. Good question. I hope that answers it. We're going to be done in 15, 20 minutes. Okay, doctor?
Yes, sir.
She okay now?
Yeah.
So where do you normally work if you're not here?
Daytona Beach, Port Orange area.
Still working with those guys up in Daytona?
I left their hospital though.
Why?
Oh, to answer your question, no, because they're still at the hospital. So I'm at the surgery center.
Nice.
Pretty much have our own group,
When you say we have our own group, you mean
6 partners,
a group of anesthesiologists or surgeons? Okay.
anesthesiologists,
And you guys serve surgery centers?
surgery centers, and the hospital in New Smyrna.
I see. So, you do a lot of what kind of cases? Oh, we have more cases from our audience. Hold on, more questions. What? Give me a second. What other questions do you have, Sean? I'm sorry. I got a little carried away with a side conversation with the anesthesiologist.
I'm sure they don't mind. We have another viewer wondering, they had a cyst removed from their spine and their lower back, and now their legs burn and are numb. They want to know why that would be and what can be done to help it.
Yeah, great question. So there's somebody who's watching who's had a cyst removed from their spine, and now their legs burn and they're numb, and they want to know if there's anything that can be done. So your answer is the answer is very complex because it really depends on the cause of your burning and numbness. So let's go through the possibilities. One possibility is that the burning and numbness is from a spinal cord injury and that the cyst was in the spinal cord and the spinal cord was damaged by the cyst or by the surgeon. If that's the case, that burning and numbness will never go away because it's probably permanent. Now, there's medications and there are treatments that can be done to help. Most specifically, something called a spinal cord stimulator. A spinal cord stimulator, SCS. And those are put in all over the country. We do them at Deuk Spine Institute. We do them very well, but you don't have to come to us to get one done. So a spinal cord stimulator would be one option. You'd have to do a trial for 5 days first, and if it works, then you get a permanent one put in. Okay? Option number 2 is that there's still something pressing the nerve, even now, and that's what's causing the burning and numbness. If that's the case, you need another surgery to fix it, and that's something that I could do to help you with. Option number 3, your burning and numbness in your legs is completely unrelated to the cyst, and it's related to something like neuropathy or diabetes or something else, in which case you need that treated. And option number 4 is that the burning and numbness in your legs is due to a medication that you're currently getting. And if you stop that medication, it'll get better. That's the least likely, by the way, of all the options, all the possibilities. The greatest possibility is that someone damaged, either the cyst or the surgeon damaged your spinal cord and caused permanent damage, which is causing burning and numbness in your legs. That's the most likely cause. The second most likely cause would be that there's residual narrowing or pressure on the nerves that needs to be addressed now. How could we tell? Well, I need to interview you. I need to examine you. I need to see your MRI, your current MRI. If I had all that information, I could probably help you and figure out what it is that's a problem and what can be done to help you. So if you can get your MRI in, a new one, after your surgery, get it in so I can see it. You can upload the MRI in the Deuk Spine Institute app. Go to your app store and download the Deuk Spine Institute app. It's free. And we do free MRI reviews. So you don't even have to pay any money. My services are here for you for free. More volume, please. And we can't just listen to the Red Hot Chili Peppers. We're going to need to put something else on. As much as I love them, stand by. I need some variety. Yeah.
Does tight iliopsoas muscle ever cause lumbar, pain in the lumbar where it attaches to the lumbar section?
Does the iliopsoas muscle spasm ever cause back pain?
Yes.
Never heard of that. Somebody asked if a spasming tight iliopsoas muscle can cause back pain. I mean, I suppose it could, but I'm not aware of it. That would be a good question for Dr. Patel, my partner, or Luis. Wow, look at that tear. And so it happened after you ran a marathon? Sorry to hear that. Talk to Dr. Patel. He's the best, most knowledgeable person about muscles. My specialty is bones and joints and not muscles. Though I respect muscles and care for them, I don't really treat them. Oh, one of my favorite songs. A little more volume, please. More, louder. Stand by. Any other questions from our audience? This is the tear, by the way, in the disc. that allowed the herniation I'm fixing right now.
We do have another. A viewer asks,
Hold on a second. No. I want the volume where it is. Hold on the question. Stand by. The spider sack. Put another quarter in the jukebox.
Did you say jukebox?
The jukebox, that's right. Here's the epidural fat. You can see the end plate of L, where are we? That's going to be L5 on the left and the end plate of L4 on the right. It's a lot better when there's no blood blocking your view. Just about done. And I have one more disc to do. Guys and gals, this patient would have had to have a fusion just like the last one if it wasn't for the Deuk laser disc repair.
Facebook has blocked us. This is the annular tear debridement, by the way. I've been doing it now for the last 10-15 minutes. By doing this, it'll allow the disc to heal properly.
Okay. I think that's it for this disc. Let's go look at the nerve root. There it is. Right there. Pretty cool, huh? Let me just zap a little bit of this stuff away. Just below the nerve root. Give me 1 minute left. Just don't want anything coming back. Die. Okay, there she is. Laser off.
Lights on, please.
Okay, very good. All done. At this level, one more to go. Sorry, Facebook. We apologize, but we kind of knew Facebook would kick us. But we had to listen to that song. Oh, nice. Good for you. You got some good taste in music.
Yeah, she's old.
Catawampus. Okay.
So they kick you out of Facebook that quick? So they have to
Oh, yeah. Yeah. If anyone has fun, if anyone has real fun, then Facebook shuts you down. God forbid we should have a party or something. They would just shut us down forever. Let's get her in. So what do you want to do, Sean? You're hitting the thing there. Come south. You need to be coming south. Remember you went south. I need to watch the pedal there. We need to grab the pedal because he's going to hit it with the fluoro. You got your cable in front of your wheels. You're going to want to do something about that. Lift it over. Yep. Now move your fluoro in and down. Sean, do you want to, we're still broadcasting, right?
Yes, we're still live on Facebook and Twitter.
Fine. Who shut us down then? Periscope?
Facebook.
Well, how could we be live on Facebook if they shut us down? Other way. Or are you going to go?
I was gonna check.
No, it's lateral. Move in. You need to go in more. Okay, so anyway, should we answer the rest of the questions or should we wait?
I think I may have said Facebook mistake. I meant we are still live on YouTube and Twitter.
That's what I thought. So answer questions or wait?
We have some questions from Twitter
Yeah,
that
I
we can
think they
still
allow
answer.
us to do video, but just no audio. So we'll go ahead and answer some more audience questions. What's the next one?
The next question is a viewer on Twitter who's wondering, how likely is it to re-herniate from the same disc that you operate on with DLDR?
That's a great question. So one of our viewers says, Dr. Deuk, how likely is it to re-herniate on the same exact disc that you do the DLDR? The answer is 1%. 1% of the patients. I need the table down a little bit, and I need you centering that disc. Shot. Let's see where we are. So the answer is 1%. I think I can work with that right there. I think I can work with that. Let's see. Shot. 1%. There's a 1% chance that any patient that I do surgery on with the DLDR is going to have to come back because their pain comes back and they re-herniated their disc. That's 1 in 100. Obviously, 1 in 100. I don't mean that facetiously. I mean that's really what I have. I've done over 1,000 patients, and I've had 11 come back with recurrent herniation. And every single time it has been because the patient has done something that they shouldn't have done. Except one time where a patient told me they don't remember doing anything they shouldn't have done. But discs don't just reherniate themselves. That I know. So, hey, she's moving. She's moving. She's trying to get away, which is understandable, Shot. I would be trying to get away from myself too. Right? Luis would be trying to get away from me too. Because right now I'm not making her very happy. And it's about to get a little worse. But it's necessary. Shot? Alright, let's see where we are. That looks good. Huh. Shot? I see. Now, just because Facebook shut us down for our music doesn't mean we can't listen to music. As a matter of fact, that's all the more reason to blast the music. Sorry, but Mark Zuckerberg's done nothing to help our cause. And I don't expect him to either, just so you know. No, just that one stream. I usually fight it, and then they repeal it half the time, and they say, oh yeah, you're right. Because what they're looking for are people broadcasting, trying to make money, you know? You know, basically, a copyright law doesn't restrict the use of music for like a little party or something. It's only restricting you using their music to make money, which we're not doing a money broadcast. We're doing an educational broadcast. Ooh, this is that really bad one. I can feel it. Yeah, it's super tight. Yeah, good song. Are we back up on Facebook or not?
Not yet. We'll have to appeal it.
All right, so crank it up. Shot. Shot. Did I mention that some of the video scenes during the surgery can be disturbing? Everyone complains about me hammering this thing in as the one thing that bothers them the most. Thank you, Luis. Smart man. That's what I think. That's using your brain. Thinking ahead, anticipating, preparing. I love it. All right, go ahead and take it out. We should be done in 10 minutes. Scope on. Got it. cancer grow. Are you able to pick songs or are you just playing? How about some Scorpions, Winds of Change? All right, Sean, you have another question for me?
I do. It was actually a viewer who had posted the first question we answered from the spine support group.
Okay.
They asked another question that said, what are the alternatives other than a PARS repair at L4, L5?
Well, the alternative, if you're having pain, the best surgery you could do is what I'm doing right now, Deuk laser disc repair. It won't fix your PARS, but you don't need your PARS fixed. The real question is, how much listhesis do you have? Do you know if you have a grade 1, grade 2, grade 3, or grade 4 listhesis? And if you have anything more than a grade 1, you shouldn't even consider a PARS repair, because it's not going to work. And if you have a grade 1, which I assume you have a grade 1 or grade 0, the best surgery in the world is laser surgery that I'm doing right now. You don't have to have open back surgery. We could just get in there and fix your disc with a laser and leave your PARS alone. That's what I would recommend. And that should fix your pain. I'd be happy to do a consultation with you before you go have your surgery. Is she okay?
Yeah.
We got 5 minutes left, so you can start lightening her up. The consultation I do with you could be over the internet. You wouldn't have to pay for it. It's free. Just send your MRI or your CAT scan or both in through the app and then schedule a 10-minute video conference and I'll talk to you. I just hate seeing people do treatments that don't work because that's what the surgeon wants them to do or that's what the company wants them to do. I mean, I'm a patient too at times. Last thing in the world I want is to have a surgery that doesn't work or a surgery that can hurt me. And then I'm hurting even worse or I'm dead because of complications. It happens all the time with spine surgery. That's why we do this broadcast, to educate. To what? We're just about done. 4 minutes. This is the best Scorpion song ever made. It's not Winds of Change, but it's the best. Still loving you. Oh yeah, she doesn't like this. She's a wiggling around. I think our irrigation is getting light. Luis. How's our irrigation? It looks like I barely have any.
It's actually very high. I can just try a different
Try pumping it. Just about done. Can see the, huh?
Is it better?
I don't know yet. It looks a little bit better. Yeah. Oh, there it is. The spider's nest. Don't let her come off the table. 2 minutes.
Crystal, can you let people know that we have 2 minutes? We have a little room, please.
They come back here. Come back to this.
We're going to follow this room.
Yeah.
Luis will turn it over.
Lights on, please. We're done.
Scope off. Almost done, sweetheart. Lay still. Just give it to me. All done. You did great. Push, her.
Crystal.
Just lay still. Great job, everybody. I'll come answer questions. Oh, beautiful. Thank you. It's okay. It's okay.
So yeah, she didn't give us the.
Yeah, it's okay. Don't worry about it. It's mostly, it was so bad, but she's going to do great. I'm not worried about it. Thank you. Well, folks, there you have it. The Scorpion's greatest masterpiece. Still loving you. And yes, of course, Spine's masterpiece, the Deuk laser disc repair. I'll come answer your questions in a minute.
All right, everyone. Thank you for joining us for the post-op Q&A. A couple of viewers from Periscope have a question for you, Dr. Deuk. The first one is, are there any new procedures out there to fix damage to the spinal cord in the lower back?
All right, are there any new procedures out there to fix damaged spinal cord? Unfortunately, the answer is no. Not today, but there are technologies on the horizon, and one in particular that I think is going to be potentially very, very successful is where we basically take, well, let me back up a minute. So the things the spinal cord controls in the lower body are the bladder and bowel functions, the movement of the legs and the feeling in your legs, and of course erectile, sexual performance functions. So when somebody has an injury to their spinal cord lower down in the lower back, it's going to affect from their belly button down, basically sexual function and feeling from the waist down, loss of feeling specifically, loss of movement from the waist down, not able to move the legs because the muscles are not getting the signals from the brain, and control of the sphincters, the urinary sphincter and the fecal sphincter. So these patients with spinal cord injuries end up not being able to walk, not being able to use their legs. They get contractures of the legs, which are horrible. They get bed sores, obviously. They get no feeling in their waist down, so they can't feel things like pressure on their skin. They can't move their legs to ease that pressure and get the circulation going again to certain areas, so they get breakdown and decubitus ulcers. So really horrible conditions. Obviously, they need diapers, and there's really zero sex life. So is there hope on the horizon? Absolutely. For example, I believe that there's a way to bypass the spinal cord and connect the brain directly to the muscles to make them work. And not just directly to the muscles, but through the same nerves that normally innervate the muscles. And by stimulating those nerves based on intellectual control, you're able to regain control of your muscles. Now, what about feeling? Could you bypass feeling? That's going to be harder to do. It's going to be harder to reinstall sensation. In my opinion, you're going to get, sexual function back before you get feeling of the skin and positional sense in your lower extremities, in your legs. And what I mean by sexual function, obviously we have medication now that can give a man an erection if they're not normally able to get one. Now you can't feel anything, obviously, but the performance side obviously is able to be enhanced with medications. So the technology that I'm most excited about is bypassing the injury to the spinal cord using a circuit and directly stimulating nerves that go to muscles in the legs. As a matter of fact, this was an idea that I developed as a resident in neurosurgery back in 1998. But I never went down that path of doing the research because I had a different research project that came up, which was trying to help people with epilepsy. So I did my fellowship in epilepsy surgery rather than in functional neurosurgery, which is what you would call the area of neurosurgery helping patients with spinal cord injuries. So great question. But aside from that technology, though, I don't know of any other technology that's going to actually help with the spinal cord heal itself.
Our next viewer wonders, how do you see insurances covering DLDR in the future? What do we as patients have to do to get insurances to accept this as the new standard of care?
Okay, so how do you see insurances covering this procedure in the future, and what do we have to do to get insurances to accept this? The fact of the matter is that this surgery, the Deuk laser disc repair, is just one example of hundreds of treatments that have been developed in the last 15 years that are quite better than existing treatments. However, the insurance companies do not want new treatments, okay? You don't understand. The mindset of the insurance company is that they are there to make profit off of you. The only way to make a profit is to take your money, which they do as a premium, and to not pay your bills. If they pay all the medical bills, their profit will be small. If they deny paying bills, their profit will be bigger. If they deny authorizing treatments and tests like MRIs, X-rays, then the profits become astronomical, because surgeons can't do surgery without MRIs. Surgeons can't do surgeries without tests. We first must test. So by making the tests difficult to get, which they're doing, by the way, for the last 10 years, they've put up more and more barriers to getting tests done. If you want an MRI, forget it. It's almost, it takes an act of Congress to get one done. I mean, this is just spine surgery we're talking about. There's other fields of medicine that are undergoing the same issues from the insurance companies, whether it's urology, whether it's gynecology, whether it's orthopedic surgery, whether it's cardiovascular surgery or cardiac surgery. The insurance companies are not paying for new technology. They're calling it experimental. And the only reason they're doing this is they just don't want to pay. You see, it's real simple. They want to make more money. They want to make profit. And the only way they're going to make profit is by not paying for medical care. So the more things they can deny, for the more reasons they can concoct and make up, the more profit they're going to make. And there's nobody stopping them. Let me make it very clear to you. Let's pretend we're in school and there's a bully, and the bully stands outside the lunchroom. And the first student to walk towards the cafeteria to have lunch, the bully grabs them and says, "Give me your lunch money." And so the student says, "Oh gosh, I don't want to get hurt, so here's my money." The bully takes their $5, okay? And the bully goes and buys lunch, and the bully eats their lunch. But they didn't pay for it. They stole the money from the student. The next day, the bully stands outside the lunch line, and this time, two people come by at the same time. And the bully says, "Give me both of your lunch money." And the bully gets $10. Pretty soon, the bully's thinking, why am I stopping at one person or two? Let me take three people's lunch money, and even four. And I can start taking this money, and I can go buy a new car. I can buy a turbocharger for my car. I can get those new rims I wanted. I can go buy a machine gun. I can buy lots of nice things because I'm a selfish pig that cares about no one or nothing else but myself. And pretty soon the bully's taking 99 students' lunch money. Now, would you stand there and go to school every day and give a bully your $5 without doing something about it? Hell no, I wouldn't either. But why are we letting the insurance companies take our money and not give us anything in return? The money they're taking was supposed to be for our lunch. It's supposed to be for our health care. And they're not giving us the health care. So where is that money going? It's going into their profit coffers, pockets, whatever you want to call it. Okay? So, is the Deuk laser disc repair ever going to get covered by insurance? Well, yes, the answer is it will. But the only way it's going to get covered by insurance is if you, the patient, and Deuk Spine Institute work together to sue the insurance companies in a court of law. In a civil court of law, we'll sue them, we'll make them pay. That's what it really comes down to. And once they've been sued enough and they've lost enough, they're going to say, you know what, let's just cover this procedure. Let's negotiate a rate that's fair and reasonable, and we'll cover it. So, you see the problem, folks? You're either going to have to get your politicians to rewrite your state laws that deny insurance companies the right to say no to doctors or hospitals that want to treat patients, or you're going to have to sue your insurance company. And honestly, suing them works really well. They don't expect you to sue them. They deny because they expect most people just to give up. Just like the bully's kids go into the lunchroom because they expect the kids to give up. What do you think's going to happen when they go and bully student number 89, who reaches back and gives the bully a knuckle sandwich, and the bully falls to the ground and shakes their head and says, you know what? I don't think I want to bully anymore because that hurt and my teeth got knocked out. So when you knock the bully's teeth out, the bully doesn't bully anymore. The way you knock the bully's teeth out, the way you knock the insurance company's teeth out, is by suing them. You see, the insurance companies are there to help people, patients, you. And the moment the courts say, wait a second, you're not doing what's in the best interest of the patients by denying these surgeries, that's when the courts say, that's when the insurance company and the public says, wait a second, you're a wolf in sheep's clothes. You're doing bad things. They don't want that attention because they've been getting away for so long, so many trillions of dollars that they haven't paid in medical care that is necessary. They have just gotten away with it that they really want to avoid that ugly attention. So if you sue them, they're going to tap out pretty quickly, but they are going to make you sue them. The other option is to rewrite the law and take their power away for denial. They should not have the power of denial in the first place, in my opinion. It's not in public interest to allow insurance company to deny payment for medical care. It's just not. If the insurance company takes issue with a treatment that's being recommended by a doctor for a patient, or a patient wants to proceed, there should be a panel. At the very worst, a panel made up of really unbiased people that don't work for the insurance company. Of course, they're going to try to have their people on the panel, but the panel needs to be made up of people who have the general public's best interest at heart. And that panel should make the decision about whether the patient get that treatment or not. Okay? That is the problem. I don't think the insurance companies are going to accept the procedure because it's a good procedure, because it works. That's certainly not going to happen. They're going to accept the procedure just like a bully will accept the fact they're not allowed to bully anymore when you lay the bully flat out or when the bully gets expelled from school. Okay? So those are the only two ways of dealing with a bully: expulsion or annihilation. You choose. The insurance companies are no different. They are a big, fat bully. Okay, I hope I answered that question. Do we have another one?
Nope, that's it.
That's our last question. As always, it's been a pleasure hanging out with you, answering questions, and reminiscing about the insurance companies and how evil they are. We do have one more surgery to go for those of you who are really hardcore and have the desire to stick around. This is a little bit easier of a surgery in the sense that it's only a 2-level Deuk laser disc repair as opposed to a fusion that we did. By the way, our fusion patient's already been discharged home, and her sister is a nurse. They may be willing to do a testimonial tomorrow when they come back. She's going to have her drain pulled out tomorrow when she comes back to the office. That being said, the laser surgery that we just completed is doing well, and she'll be going home soon as well. But we have one more case to go.